I am Christelle from Diabetes Strong, and in this video, I'll be talking about surgery and diabetes. I'm scheduled for surgery and I have to think about how to manage my diabetes the night before, during the surgery, as well as during my hospital stay. So I thought, why not share my learnings with you guys? I'll walk you through all of my prep work, all the thoughts I put into surgery before I go, and I'll also try to record how did it actually go. So I'll try to record a little bit from the hospital, as much as I can. Once my surgery was scheduled, the first thing I did was reach out to my endo to get her input on how to manage my blood sugars the night before, so I have to be fasting, the day off surgery, as well as during my hospital stay. The hospital where I'm getting my surgery won't allow me to manage my own blood sugars during my hospital stay, which is fairly standard. So I also emailed my endo my current insulin settings. That means how much long-acting insulin do I take and what time, what are my carb ratios, what are my correction factors, because I change those on my own fairly frequently. And the hospital wanted my management regime directly from my endo. So I sent her my latest settings and she can then communicate that over to the hospital. The fact that the hospital won't allow me to manage my own blood sugars while in the hospital is nerve-wracking. Since I was diagnosed in '97, I have not handed over my care to anyone else. I've always been in the driver's seat. So that did give me some level of anxiety. I talked this over with my endo, and her suggestion was bring your CGM, so continuous glucose monitor, and to bring my insulin pens. That way, whenever I'm conscious, which hopefully will be most of my stay, I can actively participate in the management decisions. She also mentioned, which is not really something I thought about, that if they want to do something that I think is completely crazy, like give me way too much rapid acting insulin for a meal that I know I don't need that much insulin for, I can always deny care. But let's see, hopefully it won't come to that. But it did give me some level of ease to know that I can always say no. So what I plan on bringing along will be my long-acting as well as my rapid-acting insulin. I'm going to bring some extra needles. I'm still going to bring a few test strips and my glucometer. I'm going to bring some glucose tabs. You never know. And then finally, I'm going to bring my Dexcom receiver. So Dexcom is my CGM, my continuous glucose monitor. I usually see my blood sugars on my phone, but I want to bring the receiver because I can then also leave the receiver with the medical team who are actually doing the surgery, and they'll be able to monitor my blood sugars directly on the receiver. I'm supposed to be fasting from 11 p.m. the night before my surgery. I have to be there at 5 a.m. and the actual surgery is planned for 7 a.m. I currently split my long-acting insulin in a morning and an evening dose, so I do one dose at 8 a.m. and another one at 10 p.m. And I do know that if I miss that 8 a.m. dose, my blood sugars will start to rise fairly quickly. That means that the morning of the surgery, my plan is, also based by a recommendation from my endocrinologist, is to do part of my AM dose right before I go into surgery. My endo's recommendation is that I go into surgery with a blood sugar in the range of 150 to 200 milligrams per deciliter. So that's higher than I usually aim for. I usually aim for around 100 milligrams per deciliter. So that will require a little bit of mental gymnastics, but I'll do my best. So the reason why she wants me to run a little higher is to prevent low blood sugars during surgery. The way that we're going to do that is based on her recommendation. Remember, this is for me specifically. You'd have to talk to your medical team, but she recommends that I only take 60% of my usual evening dose of long-acting insulin the night before surgery. Thereby, I'll be running a little higher overnight. And then before I go into surgery, again, that was scheduled for 7 a.m. My usual dose is at 8 a.m. But before I go into surgery, that I take 45% of my long-acting insulin dose. Having that insulin on board will prevent me from going into DKA, and it will also help prevent that my blood sugars shoot up too high. And I promise I'll give you an update on how that strategy works.
Good morning. So it's 4:45 in the morning and I'm here at the hospital. I'm ready to go in for my surgery. My husband just dropped me off. So blood sugars overnight were okay. I am 138 this morning. You can see my graph up here. So almost at the 150 that my endocrinologist wanted me to be at. But my morning hormones should start to hit me and I expect to see my blood sugars go up just a little bit. Yesterday, my eating window ended at 11 p.m. So that means they didn't want me to eat after 11. I was allowed clear liquids, so juice and stuff like that, until 3 a.m. So I did have sort of a safety, I don't know, safety feature. I don't know what you call that, an option in case of low blood sugar. So what I did last night was at 11 p.m. I did look at my blood sugars, and I did notice that I was starting to trend downwards. So I ate 8 grams of carbs. I did a combination of dried fruit and chocolate because I wanted something that would raise my blood sugars as well as a little bit of fat. So that's the chocolate, and it's yummy. So that the release of the glucose would be a little bit more prolonged. And last night I did the 60% of my long-acting insulin. It seemed to be working okay. I am dropping a little bit more than I was hoping for, but again, my morning hormones should take care of that. So wish me luck.
Since I'll be unconscious during the surgery, there's not much I personally can do in order to manage my blood sugar during that time. So I do plan on having a chat with my anesthesiologist and simply show that person my CGM and explain how they can use that to manage my diabetes during the surgery. I'll bring along my CGM receiver and give that to the team that's doing the surgery. I don't want them to have to handle my phone during surgery. And this is what the CGM receiver looks like. So you can see my readings here, you see the trends, and it's just a small device. So I'll probably change the alarms on here. So maybe I'll do a 60 milligrams per deciliter for low alert and a 250 milligrams per deciliter for high alert, or I might turn off the alerts altogether. I'm not quite sure yet. I'll have to have that discussion with the anesthesiologist and simply say, okay, what's gonna make most sense for you guys? I'm now home from the hospital and the surgery went really well. So super happy with that. But I wanted to give you an update on my conversation with the anesthesiologist. So I didn't see him until about an hour before my surgery in the hospital. And we had a conversation about my diabetes, when did I take my last dose and all those things. And I did show him my Dexcom receiver and he found that really, really helpful. So what I did was I took off all the high alerts. So meaning it wouldn't vibrate or scream or anything when if my blood sugar were to go high, but only if my blood sugars would go below 60 milligrams per deciliter. So we just found that would be the least disruptive. And just him having the CGM, being able to look at it once in a while would be helpful for him. However, any dosing decisions would still be based on finger sticks. Once I'm out of surgery, my endo did suggest that I use my rapid-acting insulin to do corrections throughout the day and not take any more long-acting insulin until it's actually time for my dose at 10 p.m. And I must admit, I do expect there to be quite a few corrections since my body has been under trauma and my long-acting insulin from the morning dose is already lower than normal. So I would expect my blood sugars to start to creep up and that I would have to give more corrections. I will try record a little bit while in the hospital, but let's see how out of it I am and if I feel like being on camera.
Hi there. So it's the morning after my surgery and everything went well. So that's nice. My blood sugar's been running high. I went into surgery with a blood sugar so they measured it in the pre-op, I guess, and it was 167, which is right where my endo wanted it, but I could see it trending up on my CGM. And according to my CGM, it was close to 187 about an hour before the procedure. So the anesthesiologist did tell me that he had to give me insulin during the surgery. That's fine, obviously. So no blood sugars, but a little on the high side. So overnight, my blood sugars were also running a little on the high side, like 200, 240 at one point, milligrams per deciliter. And that is like way too high for me. And I was wondering about it, and I did a finger stick, and it was way lower. And that kind of made me think, and this is me not thinking it through though. So large quantities of Tylenol can impact the Dexcom readings. So they are giving me Tylenol. So basically, when you consume large amount of Tylenol, that will show up as a artificially high reading on your Dexcom. So I basically am only using my Dexcom right now for trending, in the sense that I'm trending upwards, downwards, and then I'm doing finger sticks, manual finger sticks for actual dosing. So as I mentioned, I was really nervous about the hospital not letting me manage my own diabetes, but good news, they have been totally hands off when it comes to that. I've been allowed to dose, I've been allowed to manage it exactly as I want to. So really happy with that. And I'm feeling good. I am ready to go home.
So yes, the surgery went well, which is awesome. As I did mention, my blood sugars were running high, both during the surgery actually and maybe 12, 16 hours after the surgery. So I think in hindsight, if I could go back in time and change things, what I probably would do is I would probably still do the reduced rate the night before, as well as the day off the surgery. However, I probably wouldn't dial back my long-acting insulin as aggressively the day off the surgery. So I think maybe going in with 80% or maybe even 75% of my regular dose would have been optimal for my body. But overall, it wasn't horrific. I didn't have any really, really high blood sugars. But again, if I were to have surgery again, I probably would not dial back my long-acting as aggressively the day of the surgery. But overall, I'm really happy with this. Happy being home, healing up, and putting all of this behind me. Thank you so much for watching this video on diabetes and surgery. So to be completely honest, the whole process of planning surgery, planning how to manage my blood sugar, being told I wasn't allowed to manage my blood sugars in the hospital was all quite nerve-wracking to me. I hope that if you're going in for surgery, this video can be helpful and hopefully ease your nerves a little bit. Thank you so much for watching.